Hi, my name is Caitlin Carter. I'm here today to talk about cytomegalovirus, also known as CMV. This is a common virus that most anyone can get. Once we have it, we have immunity for life, and it rarely causes complications. CMV is a virus that is part of the herpes family. It is transmitted by droplets and body fluids. It is estimated that 50% of the adult population in the US have had an infection of CMV at some point in their life, and that is as high as 50 to 80% of reproductive aged women. Primary infection, or that first infection, that is low, just around 1%, and when people get it, they may be completely asymptomatic, as in no symptoms at all, or it could look like mild flu symptoms. Achy body, maybe a low-grade fever, headache, things like that. So this could very easily be a virus that you or your children have had. You may or may not go to the doctor. If you went to the doctor, they may say, yep, it's a virus, go home. However, it can cause some problems with a baby if you were to get CMV early on in pregnancy. Some of the problems that could come up with a baby is different congenital malformations, such as hearing loss, learning difficulties, and cerebral palsy. Some babies, a small number, only 5 to 10% of the ones that may have this, which is already a small number, are symptomatic at birth, and their prognosis is not good. They may have central nervous system damage, some things like that. So let's talk about who is at risk. People who work with children, especially small children under about 36 months of age, they're more likely to get this. They're more likely to be people who work in preschools or have small children themselves. And pregnant people under the age of 20 are also at a little bit higher risk. And the counsel is really just to wash your hands regularly, take care of yourself. So, I just said some scary things. So what do we do about it? What can we be doing? Should we be doing? And the answer is not a whole lot. There is currently no recommendations to screen for it. If we can screen for it, we can do a blood test for it. If you feel like you are in the high-risk category and would like to be tested for it, just so you know, if you have already had it, or if you're at risk of getting it while you're pregnant, let me know and we can certainly run that test. There are antiviral drugs that can be used, but they're not used all that often because typically we're not finding out that people have it in the appropriate amount of time to give the medication. So yeah, if that's something that is worrying you, we can definitely talk about that. But as of right now, it's typically just a virus that you get and your body takes care of it and builds antibodies to, and then you shouldn't have any problems with it for the rest of your life. Thank you for listening to my presentation on cytomegalovirus. And some of my references are Varney's Midwifery, 2015, Miles Textbook for Women, 2015. Those are the main ones that I used. So thank you so much.